different types of referral letter, such as this is the category that I have done myself as per the different cases. So now we can see there we have a referral letter where we have a diagnosis being given. So it is quite important for you to understand that you are the one who has written this case notes. It can be technically wrong or medically wrong, but this is the information you just have to rephrase, right? This is the information you just have to rephrase, right? So why I'm saying this thing, because the next case is without diagnosis and we have the situational based letter at the same time. Anyhow, so we can see there a letter of referral with diagnosis mean that they may have written such diagnosis such as AMI, diabetes mellitus, Cushing syndrome, and so on. It can be written in this way. Today, we will be discussing majorly about the style of writing in the introduction. Thank you for seeing. This is also a convention. You can start your letter with this convention. If you have no idea how to start introduction, so these are the helping lines for you that can help you to start your writing task. So you can see there, although I will discuss this thing in the grammar portion in detail, but still, thank you for seeing. Maybe a kind of confusion for the student, because this, as it can be in your mind that patient has not been seen by the doctor by now, but normally it's run parallel. The doctor, so the patient and the letter run parallel. So we can write it down. Thank you for seeing. Similarly, the second convention is I'm writing to refer. So a 48-year-old man, now this is a positive noun. It can describe the quality of the main noun. So a 48-year or 28-year-old accountant, if this is significant, we should write it down no matter what. Anyhow, followed by, let's say, the relative clause whose signs, symptoms, and investigation are suggestive of diabetes mellitus. So there is a rule that you have to understand. Like we should put comma if there is a non-defining clause. What is non-defining clause? Stay tuned for the grammar class. Inshallah, we'll discuss. Now we can see there are two different introduction, though with the example of defining a non-defining clause. So I'm ready to refer Mr. Mark, whose symptoms are suggestive of Cushing syndrome. It's not the case that we have not written sign and symptom. We may write it down, let's say sign, symptom, investigation, if it's the case in any of the referral letters. So writing a letter with a simple diagnosis is a common or very simple letter, right? When we have the diagnosis being given, okay? When we have the diagnosis being given. So this is the first type of referral letter. Before we can proceed, if you like to ask any question, please feel free to ask. It's a letter without diagnosis. When there is no diagnosis being mentioned in the case. So maybe we have some signs, maybe we have some investigations, or maybe like symptoms. In that case, you are not supposed to make the diagnosis yourself. You just have to write it down, those sign and symptom as it is, if and only if they have not made the diagnosis. For example, if this is the case, we have the investigation value is being written in the last part of the letter. We have some symptoms, let's say. We have, let's say, some symptom related to diabetes. So we might not write down diabetes because as a GP, you have not made a diagnosis. So we can write it down. Thank you for seeing Mr. Alex, who presented with 3-week history of lethargy, blurred vision, and recent blood investigation showed high blood sugar levels. So I cannot write down the signs and symptoms suggestive of diabetes. So we can just write it down, the symptom as it is. Then I'm referring Mr. Alex for a definite diagnosis and further management. So this is the way we can write it down when we have just the symptoms being given, or maybe we just have the sign, symptom, or investigation being given, right? Is it clear to you? It's your differential diagnosis. Now you can see there in differential diagnosis, we may have primary issue, or let's say followed by the two types. Let's say we have a disease X, and then we have let's say further two types. For example, we can just write it down. I'm writing to refer Mr. XYZ, whose let's say sign, symptom, and investigation are suggestive of inflammatory bowel disease, secondary to Crohn's or ulcerative colitis. Let's say. So we do have a kind of differential diagnosis, a primary disease followed by two further types. Then we can see if we have the second type of, let's say, differential when we have two diseases. Let's say when we have two diseases, we can write it down those two diseases separately. Okay. We have two diseases. We can write it down two diseases separately, right? Let's say I'm writing to refer Mr. XYZ, whose sign, symptom, and investigation are suggestive of AMI or APO. Let's say for definitive diagnosis. And if you can see there, now we have these different types of letter in a differential case that we can write it down. And if we have multiple differentials, such as these are few of the examples, we can write down the differential. I'm writing to refer Mr. Alex, whose sign and symptom are suggestive of an early bowel obstruction, secondary to diverticulitis or carcinoma, for a definitive diagnosis, right? Then, thank you for seeing Mr. Alex, whose features are suggestive of acute pulmonary edema or acute myocardial infarction, let's say. Then we can write it down this thing. I'm writing to refer Mr. James, who has a differential diagnosis of, let's say, bipolar disorder, depression, and so on. That is your letter of discharge. Now, in the letter of discharge, what you can see there, we have a letter, specifically, it's a flip side of your discharge letter. What I mean by the flip side of discharge letter mean that it's your referral back. It's your referral back. Basically, we are writing this letter back to the GP. Now, primary care physician already know the basic information about the patient, right? So the primary physician already know the basic information. We should not be writing the social plus past medical history in the letter of discharge, right? Basically, we have to see that in medicine letter, social plus family history plus past medical history is not relevant. Now, we can see the letter format. It can be written in the sequence of the letter. Let's say ward stay or the admitting details, right? Then we have the, we can say the admitting details. Then we have the rehabilitation, right? And the discharge plan. So normally in the discharge plan, it should be expanded. And whatever details we have the ward stay and we have the rehabilitation, it should be summarized. So if you can see most of the time, if you can see there, we have the like lot of details written in the ward stay, lot of details in the ward stay that is being written over here, and it's less important detail that should be summarized. Then we have some information written in the let's say rehabilitation. So we have to summarize that information as well, only relevant information, right? Only relevant information should be written. After that, you have to see that discharge plan should be expanded no matter what. Okay. Now the question being asked, we have different letter. As a request letter, you can see there. So now, in a letter of request, you can see that we have letter to occupational therapist. So what is the job of the occupational therapist? He is responsible for the workplace assessment. Let's say this is the job of the occupational therapist. Fine. We have to see We are writing letter as a referral category or discharge category or to occupational therapists and request them, you know, request them basically about the, to conduct the workplace assessment. Okay. So we have to see the letter to the occupational therapist and we have to conduct the workplace assessment, right, to the patient. So the occupational therapist letter can be written to the, let's say, so to the occupational therapist so that he has to go for the home placement, right? He has to go for the home placement. Letter to a physiotherapist written to the patient for the, you can say, for the range of mobility, right? We can write it down letter to a social worker, let's say, for that he can help the patient to start or to resume the normal transition back to normal life. We can also write it down the letter to the, let's say, for the eligibility of pension care in case if the patient is broken and he or she is not basically able to manage her finance or if there's some responsibilities on the patient. So we can write it down, the letter to the pension care people so that they can further evaluate the patient regarding the need of pension. Home placement we discussed already, and the for genetic review is the for the old age people, old care. It can be in the category of referral or discharge. Just an example, I'm ready to request regarding Mr. James work-based assessment as he has been recovering after a successful right knee replacement and want to resume his job, right? So this is just an example for the letter of request. We can have in different category. Now we have a transfer letter. Now transfer letter can be written in different stream from low to high and from high to low. Then we have, let's say, ward to emergency. Low to high means from periphery to the hospital, maybe. Then we have same specialty referral. In the same specialty referral, let's say psychiatrist is writing this letter to a psychiatrist. For example, GP is writing to GP. Let's say transfer to the hospice care. It's a one-way transfer. Relocation, let's say it's a one-way transfer, right? You can write it down. These letters are transfer. Let's say I'm writing to refer Mr. Mark to your hospice care as he is on the terminal stage of cancer and he needs further palliative care. Lastly, we have education letter. Less likely we have this letter in the medicine, but you are writing this letter to educate the community. For the outbreak of some disease, we have definition, prevention, and treatment option. And the transfer or information letter, again, it's less likely we can have this information. We can be writing this letter to the update on no new disease, or maybe request to update the existing health facility, right? So these are different type of letter we have to see. We like to discuss this letter. So whenever you have the case notes, you should go to the bottommost part. And here you can see that to whom we are writing this letter. Let's say we are writing this letter to the psychiatrist. Okay. And what we can see there, it's a follow-up. So what you can get from the follow-up? What do you understand? If they have written about the follow-up, what do you think? What it could be? What do you understanding about that? It's a discharge and follow-up, you're right. But what does this mean? Why we are discharging this patient for the follow-up to a psychiatrist? It's a primary psychiatrist or it's a new psychiatrist? Sorry. It's a primary psychiatrist or yes, you're saying it's primary psychiatrist. How you can say that? How can you say that? How can you say that's a primary psychiatrist?
The patient is already on the certified person.
Okay, let's see if it's a primary or not. We'll discuss that. He's at community services. Okay, that's what you're saying. He was admitted for aggravated symptom, fine. Okay, so whatever the scene is, okay, we can see that he's at community services, that's why. So what we can see, even in the follow-up, there are some instruction regarding the medicine, right? But these are the most important point about the one-to-one psychotherapy, alcohol and smoking cessation, day program to improve self-esteem and the clinical and social stability, occasional rehabilitation, right? So everything written in this letter over here is important. Now, what does this mean about the guarded prognosis? If you can see there, the condition has been improving. That's why we are discharging. Everything is important, but judgment is still impaired. But the prognosis guarded. Guarded prognosis mean by the time he will not follow the mention below mentioned the follow plan, his condition might worsen again. So it means that he has to be on the given guideline of the treatment. Anyhow, now with reference to that, we can start reading the case note from top to bottom now. So we can see there who we are. We are basically a primary psychiatrist. Sorry, emergency psychiatrist. And now the patient details, let's say marital status single. If we are writing to the primary psychiatrist, should we write this down or not? No. Yeah. You should not write down if this is a basically a primary psychiatrist. You are not supposed to write down these details if it's a primary psychiatrist, right? So if you can see admission detail, discharge is can be written, but discharge plan is diagnosis paranoid schizophrenia, right? Afterward, we can see what about the family history? It should be written or not. Parents separated 4 years ago, divorced 2 years ago. Should we write it down or not? No. Basically, if you're writing this letter to the primary psychiatrist, Dr. Bushra, no need to mention that. No, like everything because the psychiatrist already know. So psychosocial history. Again, should we write it down this thing or not? Yes, we should not write it down. Despite, like even in the normal referral letter, if you are writing this letter to psychiatrist, it could be very important. No need to mention the brief summary even because the psychiatrist already know this thing. I would be repeating it again because this is something that is being known. I'll explain to you how. Let's say that is followed by the first letter. You can say the symptoms. Patient was first admitted with the 6 week history of confusion. We will read it thoroughly. Yeah, it's like you are a psychiatrist, emergency psychiatrist, and you're writing back to the primary psychiatrist, like that. So at that time, you diagnose the case with the paranoid schizophrenia. You have started the treatment. That was the plan. You can see there in the first visit, like May 14, 2016, you have referred this patient to the same place where you are referring right now. So the patient would, the psychiatrist would have an idea about the problem. Then we can see that was the plan, live with his mother, referred to that discussed. In August 2017, he had committed a suicide. Possible stressor was the mother idea of remarriage is quite important, and so on. Then you can see that his attendance in group psychotherapy was regular. It means that irregular, sorry, that he has been attending to this area or this community center. Sorry. Now this is the recent history. November. Again, he came to you. So still, we might not write down everything in detail. We'll just summarize even the November history. Let's say he was admitted by her mother with worsening symptom of schizophrenia. Let's say you can see the technical point is the most important detail might be written over here. It has to bring it up when you are writing this letter. Like in November 2017 or 23/11/17, she was brought by her mother with worsening symptom of schizophrenia. We not write down these symptoms. And let's say if you're writing this letter to a psychiatrist and you need to write down these symptoms, we can just write down hallucination, auditory hallucination, rather than writing the multiple voices, right? Because you're writing this letter to a psychiatrist. But in this case, we can just write down the worsening symptom of schizophrenia. And we may write it down like about her mother response that he isolated himself, and this point can be written, right? And we can give a touch to the mother idea of remarriage that was the cause of this episode. Now, hospital progression can be written as it is. Just sequence it, we need to see either we should write down sodium valproate first or should we write down one-to-one phototherapy accordingly. Or we can make a group. We can write it down, let's say sodium valproate over here that has been done in the hospital. And maybe you can club it with this information. Let's say the follow-up plan that has been written together. So we can club the information together category wise. Category wise mean the medicine that was started in the hospital and the medicine that need to continue can be written together. Let's say he was given, let's say blah blah medicine, and after discharge, I would appreciate it if he has to continue sodium valproate 250 mg and so on. Similarly, we can write it down about that he was not compliance with the group psychotherapy session. For that reason, we have started one-to-one, and we'd appreciate if you could continue. So category wise should be written. It would be both better. In this letter, sir, we will not write down social history because that social history is being known to the GP already, right? Is it clear?